And here we start with some clinical case. Two patients, the patient number one, that's the patient told to me, I'm looking for a aesthetic treatment that will help me boost my self-esteem, slim a little bit the face, and plump my cheeks. The cheek is very, very flat in this area, eliminating the tired appearance. It's very, very important and common. And I want to be radiant and confident for my wedding. It's a bride, which is approaching, and I feel like best version of myself in this special moment. So that's the desire. We need to achieve the best result to deliver this desire or this expectation for the patient. So after that, we use the anatomy guides. When I told Friday to you, we established this type of round facial scale. And here we can see that the loss of volume here, it's a very important problem for the patient. The patient put the worst note here, the note 3, the worst one, to the loss of volume. The saggy is not so important too, and everything is 2. Only loss of volume is 3. So the main concern of the patient is reestablish this volume in this lateral or the medial part of the cheek. So here we need to remember the medial third is almost zygomatic and maxilla bone. It's a very, very safe area. We need to remember the facial artery here that transform in this area to angular artery and vein. So we need to remember that the artery, the facial artery here is a little bit more superficial than other areas. And maybe we need to put our fillers here in the base of the infraorbital ring supraperiosteally here and here. So maxillary points are very concerned, are a little bit more important in those aspects, in those vascular aspects. So when we touch the bone, we need to aspirate to guarantee that we are not inside some vessel and avoid hyaluronic acid injection inside the vessel. So my treatment plan to restructure the zygomatic bone is here. You use a high G prime material. My injection will be static, immobile injection. We'll inject bolus type, touch the bone, aspirate, and inject a little bolus. We inject in the layers supraperiosteal. The instrument is a needle 27 gauge that are provided normally with the material. And I will divide 1 milliliter of hyaluronic acid of high G prime, half to the right side and half to the left side. And I plan to put 1, 2, 3 little bolus here, little bolus of 0.1 ml, 0.2 ml, the middle one, and 0.1 ml in the maxilla, in the lateral aspect of maxilla, to project this maxillary bone. So the injection normally is with needle. The left hand make some traction to the tissue in the temporal direction. So my point of injection is not, I put the needle over the mark and stretch the tissue in the temporal area so the needle touch the bone, perforating the skin in another position. So that's our planning being executed. And we can see here all the injections exactly like we planned. So 0.1 cc. And now we can see a very different zygomatic bone designed or reprojected. And we, after that, we need to evaluate if we have some stretching, like I told you before. So after that, we can see before and after stereophotogrammetries that with only half syringe of a high G prime hyaluronic material, I have another design of the anterior or lateral maxilla. The zone of tear trough is a little bit better because we reestablish support to the deep compartment, deep fat compartment here, the SUF, the suborbicular oculi fat is repositioned in the original position. So we can see this area, the corner of the mouth is completely different. It's when the corner of the mouth is stretched again, all the lateral aspect of the face need to be changed position. So here we can see a wrinkle in the corner of the mouth, and here the wrinkle disappears. So it's amazing the difference that we can establish in the zygomatic bone or the zygomatic area with a half syringe each side. And we redesign the border of the mandible too. So when we revolumize with a little bolus those areas, this grow of this area makes some lift here and lift here and traction in the skin in the base of the mandible. It's very interesting to see that. And the tear trough disappear. Look the difference of the tear trough before and after. The other side, the left side, the same. So we can see the same here. We have some wrinkle in the corner of the mouth, and here the corner is flat and shiny. So here we can see the difference in the tear trough and lateral aspect of the periorbital area and border of the mandible. The redesign 30 days before, it's incredible. The mandible is totally redesigned, and the volume of the cheeks are reobtained, and the patient is very happy. So the animation of the vector system showed to us the transformation before here and after here. Before here and after here. We have a transformed patient immediately. So here we can see in the vector analysis the difference of volume in the zygomatic area only with a half syringe each side. We have 1.7 millimeters of growing tissues in the zygomatic area, only with one syringe of hyaluronic acid. And the same patient before, we reanalysis this patient 30 days, we maintain the results, we see the vectors of the lifting in the middle third. So it's amazing. We see here the arrows pointing to the temporal zone, like we stretch the tissue before injection. It's very, very true. 60 days before, we can see the lifting effect in this lateral aspect of the zygoma area with 2.3 millimeters of lift. It's very, very important to do that with this area. So before the injection, that's the aspect of our scale. And after that, we perform again another examination with the patient. The patient classifies your face very, very, very better. So here we can see the assessment, postoperatory assessment, and the quality of the result that the patient by himself appoint to us. It's a very quality evaluation, but it's the patient evaluation. So that's very important for us.